Welcome to Using Individual Placement and Support to Assist Job Seekers and Workers with Mental Health Conditions. We are so happy that you're here with us today. Today's webinar is hosted by the LEAD Center, which stands for Leadership for the Employment and Economic Advancement of People with Disabilities. We are a Workforce Innovation and Opportunity Act, or WIOA, Policy Development Center of the Office of Disability Employment Policy. Social Policy Research Associates and National Disability Institute lead the LEAD Center. Next slide, please. So that everyone can fully participate in today's webinar, we'd like to take a moment to share some captioning and housekeeping tips. Today's webinar is live captioned. If you would like to hide captions, click the live transcript button to find the hide captions option. You can also adjust the caption size under the subtitle settings option. You also have the option to open the captioning webpage in a new browser. The link has been posted in the chat box. You can adjust the background color, text color, and font using the drop-down menus at the top of the browser. Position the window to sit on top of the embedded captioning. Next slide. If you have content questions for panelists during this presentation, and we do encourage you to ask them, please type them into the Q&A panel, and we will save time at the end for questions and answers. If your question is not content related, for example, you need tech support, use the chat box instead. Next slide. To kick off our day today, we would like to welcome the Deputy Assistant Secretary for the Office of Disability Employment Policy, ODEP, at the U.S. Department of Labor, Jennifer Sheehy. Prior to her current position, Jennifer spent 10 years at the U.S. Department of Education in many roles, including Acting Director of the National Institute on Disability and Rehabilitation Research, Acting Deputy Commissioner of the Rehabilitation Services Administration, and Special Assistant to the Assistant Secretary of the Office of Special Education and Rehabilitative Services. Jennifer came to the Department of Education from the Presidential Task Force on Employment of Adults with Disabilities, where she was Senior Policy Advisor and served a detail as Associate Director in the White House Domestic Policy Council. Before she joined the task force, Jennifer was Vice President of the National Organization on Disability and Director of its CEO Council. In 2016, Jennifer was appointed by the President to the Ability One Commission. Jennifer, welcome to the webinar.
Thank you, Maddie. I really appreciate participating today and want to welcome all the panelists and all the participants and representatives from state agencies here today. As Maddie said, I'm Jennifer Sheehy. I'm the Deputy Assistant Secretary for the Office of Disability Employment Policy, or ODEP. And we actually have a very exciting year this year. 2021 marks the 20th anniversary of ODEP. We were just created 20 years ago in 2001. So we're a young agency, but as Mayor Walsh, our hopefully future secretary, said this morning in his hearing, we are small but mighty. And I think today's webinar will kind of show you how, illustrate that point. So one of the most promising but underutilized practices for helping people with mental health conditions become employed is the individual placement and support form of supported employment, or IPS. Today, you will not only learn about the basics of how IPS works, but you'll also learn some innovative practices happening in states for providing IPS through the public workforce system. You'll hear from an impressive global leader and friend in the field of IPS, Dr. Bob Drake. Dr. Drake early on saw the potential of IPS for helping people with mental health conditions to enter the competitive workplace. And in order to ensure consistency in the provision of IPS services, he worked with a team to develop a Fidelity scale for delivery of IPS. He and his team are widely regarded as international experts in this area. The IPS model has been tested extensively, and through the years, we've come to understand that IPS not only benefits individuals with mental health conditions, but also employers, employment service providers, and people with other co-occurring disabilities. It can assist people who have not been successful in finding or keeping a job through other strategies. And you'll hear today, the success rate is impressive. You'll also hear stories from 2 states, Illinois and Missouri, about how they integrated IPS into services provided through their programs in the public workforce system. These agencies within the workforce system ensure the availability of IPS for people who need it. Hopefully, you will be able to take away 1 or 2 strategies that Illinois and Missouri use and bring it back to your own work. And now, if you would advance the slide, please. I want to tell you a little bit about Aspire, our initiative, new initiative, Advancing State Policy Integration for Recovery and Employment. Aspire's goal is to increase competitive employment for people with mental health conditions by aligning employment policies across state agencies and service providers. Aspire is a new initiative. The partners are, again, impressive. We have national subject matter experts. We have Mathematica, Westat, a terrific contractor with years of experience in the mental health area. And we also have a terrific range of policy advisors from ODEP who will be program officers for Aspire. We have an open competition. The applications are due February 24th, and 6 states will be selected who will receive 100 to 300 hours of individualized, customized consultation, especially to show the states how to incorporate IPS. So how to align policy, funding strategies, how to partner with local organizations, nonprofits, and other state agencies, and use state and federal resources in order to apply IPS and help people with mental health conditions. So as you can see, I'm excited about this webinar. And without further ado, I'm going to turn it back to Maddie to get started.
Thank you, Jennifer, so much. Let's go to the next slide. Wonderful. So I will now introduce our presenters. My name is Maddie Ruvolo, and I am an associate at Social Policy Research Associates. Also joining us is Robert Drake, a renowned expert, as Jennifer mentioned, on IPS and a vice president at Westat. Bob will be introducing us to IPS. Next slide. We also have IPS experts who will share their experience and best practices implementing IPS at the state level. Chad Hinkle is the Director of Employment Services at the Missouri Department of Mental Health. Rebecca Maynard is the Director of Mental Health Services at Missouri Vocational Rehabilitation. Chad and Rebecca will be sharing best practices from Missouri. Darius McKinney is the IPS Program Manager in the Illinois Department of Human Services. Tanya Moravec is the Deputy Director of Planning and Regional Office Operations at the California State Council on Developmental Disabilities. Tanya is also the former lead IPS trainer in the Illinois Department of Human Services. Darius and Tanya will be sharing best practices from Illinois. Next slide. All right, let's talk about our objectives today. So we hope participants will learn how IPS benefits individuals, employers, and programs, the role of the workforce system in implementing IPS, and how workforce partners can successfully collaborate with mental health partners to assist job seekers with mental health conditions. And let's zoom out for a second to talk about the bigger picture. In order to achieve WIOA's vision of employment and re-employment, agencies have to be actively and purposefully collaborating to serve individuals. Agencies, whether mandated partners or not, need to collaborate across systems with employers to enhance services for job seekers. IPS is one such collaboration. So before we move into the presentations, we'd like to get a sense of who is in the room. In just a second, a poll should pop up on your screen asking about where you work. When you see it, please select your organization type. Great, I'm starting to see answers coming in. Go ahead and fill that out now if you haven't already. All right, just going to give a few more seconds. Wonderful. All right, so why don't we, oh, Still a few more answers. Okay, great. I'm glad so many people are participating. Let's see, why don't we go ahead now, it seems like answers are slowing down, and end the polling and share the results with the whole webinar. So as you can see, a slight majority of folks today are from nonprofit organizations. We also have representation from state governments and some from local government, for-profit organizations, and other. So a good mix of folks, and we're so glad you're here. Thanks so much. Why don't we go to the next slide? Great. So now I will turn it over to Bob Drake to kick us off with an introduction to IPS. Welcome, Bob.
Thank you very much, Maddie. I appreciate it. And I've been asked to introduce IPS to the audience today, and I'm pleased to be here with my colleagues from Illinois and Missouri and ODEP. Thank you for inviting me. If we could go to the next slide, please. IPS is an evidence-based model of supported employment developed specifically for people with serious mental illness, but now being used for people with lots of other conditions or disabilities. IPS aims at helping people with disabilities get into regular, competitive, integrated employment. Next slide, please. Yeah, so, there are several principles of IPS that all of our programs try to follow, but maybe I can illustrate it best with a simple example. I work in a mental health center in New Hampshire, and we have a team that includes mental health people and social workers and also employment specialists. And a typical client, I'll call John, comes into our center, and John is a young fellow, 18 years old, just recently developed a psychotic illness that's called schizophrenia. He has finished high school, but not done any further education, and he's never worked in a competitive job. And when he comes to us, he's still quite paranoid and overwhelmed with psychotic symptoms. So on the clinical side, we work with John and his family to understand his psychotic disorder and to learn how to manage the symptoms and the disorder. But we also have a wonderful employment specialist on our team who meets with John. And the employment specialist figures out that John has great skills, as we all do in some areas, but John's skills are in the area of working with animals. He loves his dog and takes great care of his dog, and agrees with the IPS specialist that it would be ideal for him to get a job working with animals somewhere. So we as a team talk about, well, how can we find such a job? This is what's called targeted job development. And one person on the team, knows a pet store owner, and so reaches out to that person. Another person on the team rents a house on a farm, and so reaches out to the farmer. Another person on the team, or several of us, actually say, well, we have animals and we go to this or that vet clinic. And so we all check with the people we know, and then the employment specialist takes John around to see these different spots. And within 3 weeks, we've got John a job working on the weekends at a veterinary clinic. And his job is to come in and bathe the animals, walk the animals, feed the animals, and in some cases change the dressing on their wounds. Of course, John doesn't have any experience doing this kind of job, so the employment specialist comes in with him the first 2 weekends and does the job with him and helps make sure John knows how to do the job. Well, John likes this job, and over a few months, the people in the vet clinic get to know John and like him a lot. They convince him to work some on weekdays too. And when he starts doing that, of course, he's working a lot more hours, and he gets to know other young people who work in the vet clinic. So he's got a bit of a peer group, and John stays in this job, you know, for the 2 years that he's been with us, and his hours have expanded, and he loves this job. And what I'm trying to illustrate is that, you know, anyone can work. We can find a job for almost anybody because everybody's got some kinds of skills. And people want to have a competitive job so that they're out there in the real world and they're getting paid and they feel like, you know, the job is meaningful and, you know, they're doing something constructive in the world. And when we follow people with mental health problems in a real job like this, we find that they get better and better over the years in terms of their symptoms and self-esteem and relationships and sense of being part of the community. We engage always in a rapid job search like I described with John, because people want to get to work right away. They don't want to go through long training programs or be in sheltered workshops or any of those kinds of things. Everything about IPS follows the client's preferences for type of job and how many hours to work and so on. We provide supports on an individualized basis. So for John, for example, after he learned to use the job, the employment specialist just checked in with him every couple weeks to make sure that things were going well and he didn't need help. And the employment specialist also checked in with the head of the vet clinic to make sure things that were going well. We try to provide supports to the employer as well as the client. And as I described, you know, the treatment was integrated with the employment services so that John, you know, we were all on the same team and everybody was trying to help John get to his goals. And because benefits are so complicated with people who have a disability, we made sure that John, like everybody else, gets benefits counseling before starting. If I could go on to the next slide. There are now 28 randomized controlled trials of IPS for people with mental health conditions. They all show that IPS is superior to a whole variety of comparison conditions that we've tried. And they all show that once people become employed, they improve in all these other areas of their lives, being able to manage their illnesses, reporting better self-esteem and higher quality of life and so on. If we could go to the next slide. And as far as we can tell, all groups do better in IPS than in other approaches, regardless of age, gender, race, diagnosis, symptoms, co-occurring substance use disorder, homelessness, disability status in rural areas and urban, inner city urban areas, and so on. Next slide. Now, over the last 5 or 10 years, IBS has gradually been expanding to new target conditions. And this is just a list of some of these conditions. So, for example, we now have very nice studies in the VA to show that IPS works well with people who have PTSD or post-traumatic stress disorder, and even for people who have serious spinal cord injuries. IPS has also been used for a variety of other populations with other kinds of impairments, people with substance use disorders, people with anxiety and depression, which are called common mental disorders, and so on. If we can go to the next slide. people ask us, and I ask myself all the time, why is IPS so much more effective than other approaches? You know, it's really different from any of the other mental health interventions that I've ever studied, you know, case management, psychotherapy, medications, and so on. No other intervention really is 2 or 3 times better than usual services the way IPS is. And I think it's because IPS was developed based on listening carefully to consumers and trying to provide what they believed that they needed, rather than being developed by professionals or experts or government funders and so on. Another thing that's made it effective over time is that we've, right from the beginning, been doing research and trying to improve the intervention based on a large number of trials and other kinds of studies. And we've had great support from private foundations, from family foundations, and also from government. And that's allowed us to create this international learning community, which now encompasses 25 states and is also supports IPS development in about 20 other countries. So in the, maybe we could go to the next slide. Yeah, so we started with 3 pilot sites in 2000. In 2019, we were up to 24 states and 6 other countries. A 25th state just joined, and others are in preparation for joining. There are over 400 programs, IPS programs in the US in the learning community. There are actually over 1,000 programs now around the US, and probably at least that many in other high-income countries around the world. If we could go to the next slide. So we follow about 20,000 people who are in the IPS learning community every quarter. And you can see that the quarterly employment rate has been maintained over 40%, even during the Great Recession and even during the recent COVID pandemic. And that's, you know, that's over 40% in a quarter, and it's well over 50%, you know, over the year. In fact, the well-done studies show that we can help 60 to 80% of people in the US get into a competitive job and be successful. If we go to the next slide. You know, we've been developing and trying to improve and trying to study IPS for about 30 years. We've studied lots of other employment interventions, but we haven't found one yet that's anywhere close to comparable to IPS in terms of finding competitive jobs. We're a research center, and you can find, you know, everything we've done, we've tried to put in the public domain, and you can download videos and so on at our website, ipsworks.org. And if you have questions about IPS after today's sessions, please contact Susan Morris, our administrative assistant, and we'll be happy to try to send you whatever we think is the best research article that addresses your question. Thanks very much for having me today.
Thank you, Bob, for that excellent introduction. If you have questions for Bob, we encourage you to enter them into the Q&A panel. Remember, we're saving the chat for technical assistance questions, so go ahead and put those content questions in the Q&A, and we'll have a Q&A session with our panelists at the end of the presentation. All right, so now we're moving on to our next presentation, and I will turn it over to Chad Hinkle, who will share best practices in IPS implementation from Missouri. Take it away, Chad.
Thank you, Maddie. I am Chad Hinkle with the Department of Mental Health, and with me today is Rebecca Maynard with Vocational Rehabilitation. And we oversee the implementation and expansion of IPS throughout the state of Missouri. We thank you for allowing us to share some information on how we built a successful partnership between DMH, VR, and other agencies here in Missouri. We're very honored to present alongside such great experts in the employment field. You know, we're very proud of our partnership and feel that our partnership, along with the hard work of our community IPS providers, has contributed to the expansion of Missouri's IPS program. Just to give you an idea, in 2009, we had 6 IPS sites. That grew to 13 sites by 2015, and today we have 31 sites across Missouri. And we boil it down to the essence of our partnership to collaboration, communication, and respect. Slide, please. Here's our employment team at a glance, and I want you to notice the disability rights slogan, "Nothing about us without us." And that's how Rebecca and I really feel that our relationship is encapsulated. We share important information or any changes regarding IPS programs or any new employment news immediately with our staff and with our community providers. There are never any surprises because Rebecca and I work so closely together. But our employment team consists of VR and DMH staff, and all members of our team conduct IPS Fidelity reviews together. And ideally, that's at least one representative from both VR and DMH attending each review. And there's 3 members per review team. Several VR counselors are trained as IPS ambassadors, and these folks educate others on the importance of IPS as a support employment evidence-based practice, and they are also Fidelity reviewers. We have a Missouri state IPS trainer, and the state trainer tracks and coordinates all IPS reviews and provides employment trainings to providers. We also have regional DMH staff. They're located throughout the state and also provide training and technical assistance to our providers. Lead reviewers, staff from both agencies are trained as lead reviewers. And again, that's teams of 3. And finally, I want to say something about data and how crucial it is. Our team utilizes Fidelity data and employment outcomes. It's how our team defines success. And Rebecca, I think you were going to say a little bit about the data.
I'm here. I was waiting for you to turn it over to me. I wasn't sure if you were done. Yeah, data is very important to us, and we exchange our data. VR keeps up with the outcomes, the rehabilitated outcomes, the open cases, open VR cases, and the non-rehabilitated outcomes. We have first off, we have a yearly data exchange through an FTP site, where the data folks at DMH will send over secured identification numbers to the FTP site, and then our data folks picks it up, assigns it back to whatever clients within the DMH system that were employed. These include our IPS clients, but it also includes other clients under the mental health system that may reach out to VR for employment services that are different from IPS. We also have a weekly data. We provide data on a weekly status. I receive a report every Monday morning. It's a weekly report. It's more like a dashboard that we have set up through Tableau. And it actually shows us our outcomes for the week. It shows us our the cases open in the week. It breaks it down by all 31 providers. This information is sent out on Monday to the data folks at DMH, to Chad, and to Chad's team. Our team on the VR side, they have access to the full Tableau report, so they're able to go in that report anytime and look at it, which is very important during our Fidelity reviews.
Slide, please. So a little bit about collaboration. The IPS employment team holds quarterly IPS collaborative meetings, and that's between VR, DMH, and our IPS supervisors. And the purpose of these meetings is to give updates on upcoming Fidelity reviews, to review the supported employment training schedule, to give our providers a chance to share some success stories, which are oh so important, and also to give them a chance to network and find out what's working or what are some barriers in each region throughout the state of Missouri. We also, during these collaborative meetings, have breakout sessions that focus upon specific IPS principles at each meeting, and we discuss the challenges and success regarding each principle. So what that breakout meeting looks like is we will partner established IPS teams with some newer teams to discuss challenges and success with each Fidelity component. And it provides a chance for teams to learn from each other. We've actually continued these meetings virtually over the past several months and gotten good feedback. You know, also at these meetings, it provides opportunities for guest speakers, such as from the American Job Centers, housing authorities, benefit specialists, and etc. It's a wonderful way to disseminate important information to the leaders of all 31 IPS providers across the state of Missouri. And at these meetings, DMH and VR really get a sense of areas where we can work together with IPS providers to develop and implement employment trainings. The IPS team also, our employment team participates in quarterly meetings, and that's just for the team only. That includes members from DMH and VR. And this provides another opportunity to share updates among our team and discuss IPS providers' needs. And regarding collaboration with American Job Centers, we have providers who have coordinated trainings offered by the American Job Centers. What that looks like is Job Center staff would come on site to explain services and provide general trainings on job seeking and job retention. VR and DMH promotes and recognizes these partnerships. When the provider has a successful partnership, we highlight it to other providers. Also, at all of our employment resources training, we always outline the services and locations of our job centers. And I can't speak for the entirety of the state, but in Southeast Missouri and in St. Louis, there's an employment meeting led by VR that includes many community stakeholders, including DMH, job centers, local schools and colleges, local employers, support employment providers, and more. And they discuss community employment trends, job leads, training opportunities specific to the region, and usually have a guest speaker, which is often a community employer.
And also, in some of our regions, we have what we call IPS mixers. Our IPS providers, our VR counselor, our DMH staff that are in that region, they get together, they discuss employment trends, they share ideas in a more formal, relaxed environment. And some providers have branched out into social media to announce job opportunities and also to kind of keep the connection going, especially during now when a lot is being done virtually. This practice, just like our quarterly meetings, is continuing to occur, but in more of a virtual environment. Next slide, Maddie.
So regarding communication, I mentioned earlier, Missouri has one IPS state trainer employed by VR who's responsible for scheduling and communicating dates of IPS reviews. The state trainer reaches out to both VR and DMH employment team members to inquire of availability for upcoming reviews of the 31 sites. Each site receives a review annually, so it's critically important we all work closely together to stay on track with these reviews. That state trainer really keeps the pulse of the success of all providers. And I can't stress enough that if someone were to follow our model, it's incredibly important to have someone with strong organizational skills in this position. They need to be able to respond to the needs of our providers and effectively manage complex schedules. And we're fortunate to have that here in Missouri. DMH staff are also able to provide training to these IPS providers. So what will happen is that state trainer will communicate with regional DMH staff if a provider needs training or technical assistance. And since DMH staff are based regionally throughout the state, hopefully they'll be in closer proximity to a provider and provide quicker, more effective services. And our decisions are made jointly by the leadership of DMH and VR. Rebecca and I maintain regular contact with each other, and we make sure to communicate any program updates to the teams and providers.
Yes. Oh, go ahead.
I was just going to turn to you to talk about the website.
Thank you. Yes, one thing that we are very proud of and has been such a value to our team is that we have a shared website, a shared drive that the DMH IPS team has access to, as well as our VR IPS team. And on that website, it just holds so many things. The past IPS reviews, reports, resources, training materials. It allows easy access to all the documents IPS related. And I think one of the coolest tools of our shared drive is the Magic Tracker. And the Magic Tracker is basically a spreadsheet that has all of our IPS sites listed on it. And it keeps up with the last Fidelity review. It keeps up when the next Fidelity review is needed, any type of little notes that need to go in it. And as Chad mentioned before, our state trainer, who is very organized, keeps up with this along with another individual to keep it up to date. So it's just a quick glance when we look at it to see when the next Fidelity review is due, how long it's been since the last one, are we waiting on corrective action plans, those type of things. But it's a good place for DMH and VR to come together and look at all the IPS resources. Next slide, please.
And it may seem obvious, but respect is so critical to our partnership. We respect each other's experience and expertise. So on our team, we have different degrees of support employment experience, ranging from several years to just a few months. And we respect the knowledge of team members with vast and varying experiences while understanding the value of fresh eyes provided by newer team members. Differences of opinion are respected and approached in a thoughtful manner while recognizing they are a chance to learn from each other. During a review, disagreements lead to open and honest discussion held between reviewers, with the lead reviewer, either from VR or DMH, having the final determination. And finally, we respect all IPS sites. We approach each Fidelity review as a chance to shine a light on the wonderful accomplishments of an agency and also to provide them with opportunities for improvement. We never approach a review as a cold, impersonal audit. We want IPS providers to understand they are part of this partnership. Slide, please. So our administration believes that employment is recovery and recovery is employment. Support employment is viewed as equally as other clinical services provided by a treatment team. Agencies must have buy-in from leadership to build and maintain a successful IPS employment program. Our employment team is always watchful of any drift from this philosophy. You can't have a successful program unless leadership believes in the value of employment to recovery. And that's not just talking about DMH and VR, that's talking about our partners out there in the community as well. Slide, please. This just gives you an idea of how we address concerns. We're out there constantly with our state trainer and our regional DMH staff listening to IPS providers' feedback, their challenges and questions they may have. Then we may get together, DMH and VR, to discuss how to address those provider challenges before they affect Fidelity, hopefully. Then we quickly get back with that provider and address challenges based on those employment principles. And then it circles back around to constantly listening and engaging with our providers. I think this slide just kind of ties in all parties to illustrate how effective communication should work and how it strengthens our partnership. And Rebecca, you had a comment on this as well.
I did, and this is it goes towards credibility, and this will be a final comment to wrap things up. But building and maintaining credibility, trust, and respect with our providers is a priority of the Missouri IPS team. Providers are confident in knowing that when they reach out to the Missouri IPS team for assistance with training needs, questions, and concerns, the IPS team is prompt in responding and following up afterwards. And I think that has really worked to build the credibility that DMH and VR has with our providers. There's never a hesitation to reach out to us, whether it's to tell us a success story, whether it's a concern. They know that Chad and I are approachable, as is all of our IPS team. So we really appreciate being able to present to you folks today, and turn it back to Maddie.
We got one more slide, Maddie.
Oh, I'm sorry.
Yeah, so I'm just going to echo what Rebecca said. Here's our contact information. And we thank you again for this opportunity to highlight our program and partnership. We'd be happy to provide any guidance or feedback, and we'd love to hear ideas from others as well, because we're always looking to improve our services. So thank you all again, and back to you, Betty.
Wonderful. Thank you, Chad and Rebecca. And for our audience, just as a reminder to please use the Q&A module to ask any questions for Chad and Rebecca or any of our other panelists. Let's go. Oh, we're great. We're on the next slide. And so I will now turn it over to Darius McKinney or maybe Tanya will speak first. Darius and Tanya will share some best practices from Illinois. Darius and Tanya, the floor is yours.
Hi, Darius is going to kick us off by talking about some of the expansion and history of IPS across the state of Illinois. What you see up is a map of the Illinois sites via PDF, which I believe will be included as an attachment to the PowerPoint deck. Darius, turning it over to you.
Thanks so much, Tanya. Thank you so much. Thank you all for being here today. Great presentation by Missouri. To tell you the honest truth, what you could do is take their name off of everything, put Illinois' name on it, and it's the same thing. Because a lot of the things that they said was the exact same things that Illinois do as far as collaboration and communication and making sure that everybody who wants to work has that ability to work in the state of Illinois. As we see the map, right now, we started doing IPS in 2005. And at that time, we only had six IPS teams across the state. And I think we served maybe 80 people. So now, years later, 16 years later, we serve over 3,500 people a year, and we have over 50 IPS teams across the state. We have 6 IPS trainers, 2 of them or 3 of them being in Cook County because that's Chicago, and the rest of them, 1 trainer in each region across Illinois. And we have a great partner at VR, who also is a trainer as well. And together that makes our IPS review team when we go across and do agency IPS Fidelity reviews at our community mental health centers who's providing IPS services. Next slide or next. And so this is the Chicagoland area. Chicago's in Cook County. We probably have, of the 60 providers, probably about 20 or 25 of them, of the IPS teams are in Cook County.
Okay, we're going to be moving back to the main deck again.
Yeah.
And what we're going to talk about is sort of the plan for implementation. As Darius said, it started in 2005. And I want everybody to know you need to start somewhere. This is an evolving process. It takes time. It takes ongoing collaboration, and it takes some messaging from the top down, as well as a connection to grassroots advocacy. The reality is that the majority of people who have a mental health diagnosis want to work, and yet less than 15% are actively employed. Furthermore, between 2 to 5% have access to IPS services. So there's a huge demand. And we're quickly trying to expand access, and the Aspire grant is a fantastic opportunity to do so. So what we did in Illinois was really start with, talking about employment as a social determinant of health. It quickly ladders into other gains that help people feel connected, integrated in their communities, and really just lead fulfilling lives, as well as earn an income. It's a pathway out of poverty. So our consistent cross-system messaging was really not saying, hey, some people who want to work can work. It was more about normalizing employment. Instead of saying, do you want to work? We began saying things like, so what kind of work do you want to do? We also moved from a medical model to more of a recovery model, knowing that recovery is possible and made up by those different social determinants of health, or 8 dimensions of wellness, as some of you may have seen in SAMHSA's work. We emphasize partnerships and continuously expand them. And this is primarily in Illinois between the Division of Mental Health and the Division of Rehab Services, though we also work closely with the Division of Developmental Disabilities, and through our Employment First Committee, work with over 15 different collaborative partners that include places like the Department of Commerce and Economic Opportunity, which is implementing a lot of WIOA grant funding. We also train and hire certified recovery support specialists with an employment focus. So we utilize and leverage peer supports because they are a fantastic element, leading to inspiration and meaningful recovery gains. Next slide, please. And again, it's evolving, right? You start somewhere. We participate and facilitate an IPS community of practice, and we do it within the state of Illinois amongst all of our providers. We do it at an implementer's employment specialist level, as well as the level of IPS supervisors. And in addition to that, we participate in the International WestStat Learning Collaborative around IPS. So we learn from great leaders like the state of Missouri, and then we drill down and help evolve and monitor growth within our own state. We use Braided Funding. I've been monitoring some of the chat questions, primarily in the state of Illinois. It's funded by the Division of Rehab Services through milestone payments, as well as funding through the Division of Mental Health Services, who funds the majority of the trainers in the state of Illinois. In addition to that, we have applied for and obtained other grants, like SAMHSA's grant of Transforming Lives Through Competitive Employment. We communicate and calibrate on the micro and macro levels. So again, going all the way to the employment specialists, and then all the way up to state government agencies, to make sure that we are supporting each other, sharing resources, and leveraging opportunities. A great example of that was using BIP funding in the state of Illinois, the Balancing Incentives Program, to expand IPS and look at its efficacy for individuals who have intellectual developmental disabilities as well as mental health diagnoses. DRS and DMH are conducting reviews together, so really monitoring implementation and their resources from both angles. And we're continuously seeking out new opportunities for technical assistance. So in addition to leveraging funding, like I mentioned, we're also constantly looking for participation in different things like the Office of Disability Employment Policies, Employment First, State Leadership Mentorship Program, where we were a state that was chosen for 3 years and really leveraged the fantastic technical assistance that helped us look at expanding practice. So really looking at capacity building and looking at sustainability. Next slide, please. Interagency collaboration is something that was essential. In the state of Illinois, though I mentioned primarily DMH, Division of Mental Health Services, and Division of Rehab Services, the Department of Human Services was 5 different divisions. And it was really integral that we drove employment first policy as well as awareness of IPS through collaboration amongst those divisions. We also invited ISB, the Illinois State Board of Education, and the Department of Commerce and Economic Opportunity as an opportunity to really explore capacity building, information sharing, and share a common language. As I was monitoring the chat, I know some questions came up around customized employment and a comparison between IPS and customized. And I think I've always found, being a practitioner of both, that many of the things coincide and work well hand in hand. A lot of those activities support each other and can lead to successful outcomes. IPS has a clear and consistent and long history of evidence and research behind showing its efficacy. And again, I think they go hand in hand, and there are a lot of similarities, though we can't really address them in context of this presentation. We increased our interdivisional communication by having the Employment First Interagency Council. So we started with that 15 designated state agency employment and economic Opportunity for Persons with Disabilities Task Force, or EEOPD. And those different agencies came together. It was a governor's mandated task force that really looked at policies across the state of Illinois. And then because our Department of Human Services had 5 different divisions, we started another interagency work group where we together looked at best ways to improve competitive integrated employment opportunities across populations. And because of IPS's efficacy, it was a fantastic opportunity to really highlight the model and engage new stakeholders. We also scheduled regular technical assistance, and that came from those different communities of practice that I spoke about earlier at the ES and supervisory level, but also engaging the subject matter experts that we connected to via ODEP. We really had to change some policy too. So that resulted in our interagency work group really working with the different divisions to create MOUs or administrative directives to help create some structure and some transparency about how the model, how to pay for the model, how to implement the model. It was fantastically helpful within our state to have our Division of Rehab Services create a policy manual specific to the implementation of IPS and support IPS by looking at funding opportunities that really carried the model and helped us enact it with a high level of efficacy that supported job retention. I think a lot of you know that sometimes finding the job is the easy part, and then keeping the job can be challenging. So part of what this manual stated and explored was how to assist with longer term support to cover job retention. Next slide, please. This is some of the data that we collect, and I'm going to turn it back over to Darius so he can do a deeper dive with you.
Yes, data collection is a major part of what we do in Illinois. A lot of times we use that data to help provide technical assistance to our agencies who's doing IPS. What we have is an IPS web-based system where all of our agencies who are doing IPS enter their employment data into that system. So caseload size, who's working, what jobs are they working, how long they've been working, things like that. They enter all of this data in the system, and we pull it at the end of every quarter and have meetings about it, talk about it. We share it with our providers so they know how well they're doing or what areas they need to improve. But again, more importantly, we use it as a tool for improvement. A lot of times our teams, they ask us for data, even when we're trying to coordinate it and organize it. You know, they're eager for data. A lot of things in Illinois would not be successful without the hard work of our community mental health centers and our providers who provide the service. They drive the system, and as a state, we are where we at now because of our providers. They do a great job at doing IPS. They do a great job of entering their data, and likewise, when we return the data back to them, we all do a great job of seeing what areas of improvement that we can use as far as fidelity, data, quality, and all that kind of stuff. Next slide, please.
Data, again, is so important because it helps you really understand where you're at and envision where you can go and what it takes to get there, right? You know, I mentioned sometimes finding the job is the easy part. Keeping the job can be a little bit more challenging. And when we're looking at the workforce development system for people who have disabilities, we really need to keep our eyes on upskilling and career laddering, so advancing. Bob's example in the beginning was really great, where the individual started at part-time and then really kind of learned that they were more capable and interested in advancing and moving to full-time employment. So really carrying that pathway forward and helping people grow within career sets like we all have. Another cool thing that Illinois does is the IPS certification of Fidelity reviewers, or the SIFSTR. And that basically is creating a Fidelity reviewer role for people who are experts within IPS implementation. So we looked at high performing sites and we looked at the supervisors of those IPS programs, and then within the DOORS structure, they funded, or DRS, funded individuals to serve as kind of guest Fidelity reviewers, and that really allowed for that cross-pollination or fertilization of skills. It was really beneficial to both those supervisors and the programs that they were reviewing. One thing that's really important is to learn each other's languages, intake, and reporting requirements, because each division speaks a different language, has different recs, and if we don't know those, we're going to be continuing to sort of misunderstand and maybe not meet the needs, creating a more cumbersome process and challenges within collaboration. So we spent a lot of time doing some resource mapping and kind of understanding process. That really helped in terms of opening cases with our Division of Rehab Services, because we learned what their intake needs were, and then our collaborative partners implementing IPS on the mental health side put together a referral packet that answered all of those questions and helped to expedite those openings. And that was part of our streamlining of paperwork and pre-planning process. This is a step that I don't think anybody could skip, because it's really essential to kind of expediting and helping things move more slowly, greasing the wheels, so to say. Next slide, please. And the messaging, all people can work with the right supports, and that is important to talk across every single agency. One thing that I learned and that we really worked towards in the state of Illinois was when we engaged our WIOA partners and the Department of Commerce and Economic Opportunity. There was a fantastic opportunity to learn that shared language and to help understand that people can work and want to work, and understand the business case for hiring individuals who have disabilities. One of the really helpful initiatives we took on was engaging with Cornell's diversity partners to talk about the business case and to engage American Job Centers and our Division of Rehab Services and Division of Mental Health, as well as community rehab providers, to all work together to talk about this shared mission and outcome, and to leverage or develop some mutual talking points that really pointed to the business case to support our IPS clients and other job seekers who have disabilities. And what we learned through that initiative was really that the business services representatives on the AJC side hadn't been provided some of the basic training around how to effectively kind of interact with individuals who have disabilities and support them, as well as understand some of those business bottom line benefits. So when they went out to talk to employers, they could advocate for every participant in the AJC system, those who had disabilities and those who didn't have disabilities. And a really great kind of joint activity that came out of that was when our VR job development specialists went out with some of those business services reps, and they kind of showed each other how they do it, how they go about it, and learn from each other. And that type of mentorship and sharing is one of the most important parts, I think, of building a skill set and confidence in representing individuals who have disabilities effectively. So that's a bit about our path. I'm so thankful to be on the panel with such fantastic IPS supporters, and thankful that you're all here to learn and share questions and insights that you have. I'm done.
Thank you, Tanya and Darius. Okay, great. We're going to move very quickly to the Q&A slide. Those were wonderful presentations. We are going to go just a couple minutes over, but we are recording this, and this will all be available online next week. If you have to go, we understand. So in the interest of time, I'm just going to kick it off with a question for Chad and Rebecca. Chad and Rebecca, in Missouri, do you braid funding between VR and DMH? Does Medicaid play a role in funding? And if so, how does each source pay providers?
Okay, you want me to take that, Chad?
Go right ahead.
Okay, Missouri VR, we have a milestone payments fee structure. And so VR provides the 4 levels of payment to the for the IPS case record. DMH, we braid in different ways. DMH provides, or Medicaid provides, benefits planning. The career profile is done prior to coming to VR, so that is done under DMH. And also DMH provides funding to for the training for certified benefit planners. So our braiding is a little different, but we do consider it braiding because we're both paying for different parts of the case. Chad, do you have anything to add?
No, just that you're correct. We were fortunate enough to have some funds this year to send several people to the Cornell Benefits Planners course. So that was something that happens on the DMH side.
Great, thank you. Just one question for Bob. So how does IPS differ from integrated resource teams currently being done in workforce development for those with disabilities? How can we coordinate with the workforce system?
I don't think I'm the best one to answer that, Maddie.
All right, well then I will throw it out to any of our other panelists who want to answer that question.
I think that one of the best methods to coordinate or interact is to, again, sort of learn the language and offer supports and services for the business services representatives to implement WIOA, right? Making the services as well as the site accessible. So that started with us by kind of going into some of the American Job Centers and asking, how do you work with individuals who have a disability? And we found out initially that the first step was sometimes referring directly to DRS or DOORS. And we talked about, well, you know, that might be necessary or of interest to some, but those who don't want to go that path, what can you provide or what do you know how to provide to that individual when they walk in seeking assistance? So we talked about different types of accommodations or technological accessibility issues. We introduced IPS, the recovery model, and also those basic accommodations that you can find at JAN, and some of the research that's been done on reduced turnover or debunking realities, debunking myths around the costs of accommodations and things like that. And we found that to be extremely helpful in the Workforce Service Center in terms of helping build comfort as well as access.
Great. Thank you so much. We're just a couple minutes over time, so I'm really sorry. There were so many good questions. Let's go to the next slide to wrap things up. So before we go, if you're not already connected to the Lead Center, please sign up to get newsletters and notifications. Next slide. Finally, thank you all so much to our presenters, our wonderful presenters, and all of our attendees. Stay safe out there, and we hope you have a great rest of your day. Thank you.